Well, what a year 2020 has been and continues to be. A lot of anxiety for people of all ages and from all over the country. And now as we get closer to the election and the holidays, all in the midst of this pandemic, well, chances are your emotions are at an all-time high. And that extra stress can take a huge toll on your health. I know, just add to the mix, right? Well, here with more now, daytime cardiologist Dr. Shobha to talk about emotions and our hearts. And Dr. Shobha, always good to have you on the show.
Good to be here.
And we were talking about just what a timely topic this is. Really, all of 2020, I think people have been a little anxious, but now it seems like as we're getting closer to the end and the holidays and the election, a lot of stress.
That's true. And unfortunately, it's been a year of turmoil with masses of people having the same set of emotional concerns. There is anxiety, but there is also fear. And there is, some people may have lost hope in the process. And you know, so there's a lot of commonality in the emotions that masses of people, and not just in one country, it's like throughout the world, that people are facing this year.
And so, of course, that's mental health, but that mental health can have such a toll on our physical health without us even knowing it.
That is correct. Our mental health puts a huge imprint on our heart, and sometimes it is temporary, and sometimes, unfortunately, it can be permanent. So it is very important to keep our emotions in check when we're talking about heart health. You know, oftentimes we talk about the metaphorical heart. You know, when we say we love somebody, we always do the heart shape. We say, do what your heart says. And then we talk about our gut, you know, go with your gut. So is it true that some of these neurologic connections that we have with our heart, with our gut, with our brain, are so intensely combined that they affect each other? And the answer is yes, and in a big way. What we eat can affect our brain, how our brain thinks can affect our heart, how our heart behaves to the stresses that we have can in fact you know, cause a reverse contribution to our brain and to how we eat. You know, we say we eat our emotions. When women are depressed, they'll eat all the junky food that's out there. You know, you just went off a segment on insulin and diabetes. Do people care when they're depressed? No, they will binge eat anything that's out there. And what does that do? You're sitting in your own little room, depressed, tired, eating all this bad stuff, you're not exercising. Well, of course, you'll have a physical problem with your heart. You will have bad cholesterol junk get deposited in your arteries. And this may cause a permanent effect where you could be predisposed to heart attack. You eat a lot of salt, you're going to have high blood pressure. You know, and so there are a lot of examples of how the brain affects the heart. And we can go through them one by one as well. But you know, how we regulate how our heart behaves to stress is so important, because if we are going to get very anxious and our heart rate and blood pressure go up, our brain will get even more anxious. So you know, anxiety will breed more anxiety, so to speak, and cause a permanent damage to the heart or a temporary damage. Your heart might go out of rhythm. It may cause a condition called atrial fibrillation. Women especially are at risk for a condition called Takotsubo, or broken heart syndrome. Happens to men too. And this is all purely what we call stress related. Somebody has a very bad event that happens, somebody dies in the family, and all of a sudden they have all the symptoms of a heart attack and congestive heart failure. But the good news for that kind of heart disease is it can be temporary. It can be. Some people may not even survive the initial process. They may have a bad heart rhythm problem and just die from it. However, if you survive it, within 2 to 4 weeks, your heart muscle may completely recover back to normal, as long as you keep yourself emotionally peaceful, you have hope, and you have family support. Some of the best treatments for that kind of heart attack and congestive heart failure.
It'll actually fix itself if you fix what's up here.
That is correct. That is correct.
So how can we consciously try to make ourselves happy as we kind of go through this? Is it about perspective?
I think some of it is perspective. I think some of it is the way you start looking at life. You know, unfortunately, in this day and age, we are into day-to-day survival. Some people don't have food on their table, so they are busy just trying to do whatever they have to, and they're stressed because they have to provide the next meal for their child or for themselves. that sometimes is not avoidable. You know, how you deal with it becomes extremely important. There are people with good paying jobs that are miserable. They are not happy at all. They may have depression and not even know it, and it is affecting their health. They are going to work stressed out. They are staying at work stressed out. The relationships they have formed at work are stressful. They come home, they brood over it. They go to bed depressed. They wake up angry. So even people with jobs can have those issues. So how you react to stress is important. And remember, if you're depressed, recovery from heart attacks is not easy. You need hope, and you should not be depressed when you recover from bypass surgery in order to have good outcomes. So important.
All right, well, a lot of good information. Always great to have you on the show. I love how you put everything kind of into perspective for us. If you have other questions, you can call this number. Also, www.heart.org for more information, keeping our hearts healthy. We'll be right back.